Hello and welcome to For Real. My name's Claire. My husband Jeremy and I live in Siem Reap, Cambodia. I wanted to make this video to discuss some of the medical options available here in Siem Reap and also to share our first-hand experiences of a few different facilities. There's a lot to cover, so I am going to read some information that I've prepared. Let's go. So firstly, I guess it's important to briefly mention insurance. We have insurance that covers us for the big catastrophic things, like an accident or a bad, severe illness. But for small things, we just pay out of pocket. I understand that viewers of a certain age or those with pre-existing conditions find it really difficult to get a company to insure them. I really sympathise with you if that's the case. A lot of people in this situation tend to self-insure, and by that I mean they have a chunk of money put aside that they don't touch, and it sits there in case of a health emergency. In this video, I want to talk about some of the options you have available in Siem Reap, as there is a range of different health services you can use. First up are pharmacies. There is no such thing as a prescription here in Cambodia, and the pharmacy, if it has what you're looking for, they will be more than happy to sell it to you. First and foremost, pharmacies here are a business, but they will be happy to advise you on health-related matters if you ask them. There are a couple of pharmacies in town that have very knowledgeable staff, and two that we recommend going to are Pharmacy Cravan, which is in Wat Demnak, and Angkor Pharmacy on Sibatha. Both of those have excellent staff who you can talk to about any symptoms that you might have and things like that, and they will be able to advise on the best course of action for small things. Pharmacies here do tend to stock medication under different names, so it might be brands from India or France or places that you're not used to, and it might not carry the same name that your existing medication has. So make sure that you know the generic name of the drug that you're taking, and that will be helpful for you in being able to source what you need. So next up in your line of health defences is pathology, and in particular, Prasat KO Pathology Lab. It's on Wat Bo Road, and the doctor who runs this facility speaks great English and was trained overseas. Again, you don't need a referral to have a blood test. So if you've got things that you monitor regularly, you can just go and have those done. For example, I monitor my iron levels and my thyroid levels because they've been borderline in the past, and I can go and do that without an appointment or a prescription. The doctor will draw the blood, do the tests, then later that day he'll send me a PDF of the results, with anything outside the normal range highlighted. So you don't have to interpret the results or anything like that. It'll all be there for you. If anything is concerning on that result, I can then go and see a doctor to discuss it if I want to. And this brings me to the next level, and that is to see a doctor at a clinic. We've been to see Dr. Lame at CamboCare a few times now at his clinic that's located on Bamboo Street near Wat Demnak. This is a really good option if you want a doctor to have an ongoing record of your health on file, as you'll see the same doctor every time. There's only one doctor, it's his clinic. So he'll have those records and there'll be a continuity of service if you go there. The fee for a consultation there is $12.50 and the doctor speaks great English. His name is Dr. Lame. There's no hospital facility attached to that. It's just a surgery, like a small, very small facility. So if you think you might need extra services beyond what's available in a doctor's surgery, you might need to go to one of the hospitals in town. If you think you have something like dengue or typhoid, you can head to Nektep Hospital. We've been there several times now, and it's a good choice if you live close by. However, services can be hit and miss. There's a lot of staff and a lot of doctors there. I have read some negative reports in the expat groups recently. I think it's highly dependent on which doctor you see when you go there. So you could get lucky and have a really good experience. They do have in-house pathology, and it's generally not a long wait to be seen. A consultation is around $25, and if you need treatment, it can usually be done on site, as the upstairs area is a hospital. The building itself is a converted hotel, so it doesn't really feel like a hospital. It feels a little bit subpar, I must say, not the most hygienic of facilities. Jeremy had typhoid back in late August. That's something that we didn't really share that widely with people. Anyway, his treatment was a course of IV antibiotics administered over 7 days. So here are some photos from that time. You can get a sense of what the clinic is like. Yesterday, we made a visit to the Angkor Japan Friendship International Hospital to see if I could get a tetanus vaccination. As you will see, it is a clean, modern, purpose-built facility with professional staff who speak English, and they're absolutely lovely. It is a little out of town, but I would make the effort to go there rather than Nektep, particularly if I thought I might need to be admitted. I've been to both of those facilities and I know which one I would rather be in if I was staying overnight. This hospital also has an annual health checkup package, and that might be something you're interested in if you're one of those people that has to self-insure for different reasons. I'll tell you a little bit more about that later on in the video though. The Rolls-Royce of hospitals in Siem Reap is the Royal Angkor International Hospital on the highway, halfway between Siem Reap town and the turn-off to the old airport. It's going to cost you to even set foot into that joint, and unless you know that your stay there is going to be covered by insurance, I'd probably avoid it. Having said that, the facilities are like a hotel, and if you can go there under insurance, why not? As this is the best hospital in Siem Reap, they tend to have the most advanced scanning and imaging facilities there, the best technology, and also the biggest range of specialists available too. So if you need a specialist in a more niche kind of area of medicine, it's more than likely that if that person is available in Siem Reap, it will be through that hospital. So for some things, if you want to be treated in Siem Reap, that's where you'll need to go. Right, so now you have the overview of the different options available in Siem Reap. Let's go and have a look at the Angkor Japan Friendship International Hospital. I'll see you there. Here we have it, the Angkor Japan Friendship International Hospital. It is a 24-hour place, and they do have ambulances and emergency department and stuff like that too. So let's go in and see what it's like. Beautiful day again. Couple of ambulances over there. It's the way it is here. The hospitals have their own ambulances. It's not like a centrally run kind of a thing. Let's see. I wonder if I should have worn a face mask. Probably should have. We'll see. Okay, we're here in the reception area. So far, impression's very good. What do you think, Jeremy?
It's nice and cool.
Very nice. It certainly looks and feels like a real hospital. There's toilets over there. There's a number of leaflets and things. You can see they do women's health, like pap smears and stuff here too. Okay, so I've just noticed they offer an annual health checkup here. There's 4 levels and they all include a physical exam, tests for glucose, cholesterol, urine exam, chest x-ray and an electrocardiogram. And as you go up the scale, more is included in each one. So the basic package is called Classic and it's $68. It's only for people under 30. If you're over 30, the cheapest option available to you is the one called the Master. The main difference is that it includes an abdominal ultrasound. The Gold includes liver and thyroid function and a stool exam at a cost of $178. And at the top level is the Platinum. It includes everything the other levels have and also 5 tests for cancer antigens. It costs $300. I can't imagine what that kind of thorough test would cost back home. And having this test every year might be some kind of alternative for people who can't get medical insurance due to age or maybe pre-existing conditions. I guess it would give you a good picture of what's going on with your health, and you can be proactive in managing those things as soon as you find out that there might be an issue. So, could be a good option.
Doctor consulting, laboratory room. It's just a laboratory, really, wouldn't it be? X-ray room. Ooh, that's where you want to become the Hulk. Oh, don't go in there if you're pregnant or you think you may be. Caution: X-rays, gamma rays. Roll out. Oh, that's the gynecology, gynecology room. It's available. If you really want to get gynecology stuff done, it's available.
So you're coming for tetanus vaccine?
Yes, please.
Hey, around the corner. Secret cashier. $8 for tetanus. Tetanus.
Thank you so much for watching this video. I hope you found it helpful and informative. It is something that we get asked a lot about, particularly people that can't get insurance want to know what their healthcare is like and what it costs. So hopefully this has gone some of the way to telling you what's available out there, what it costs, and what might be an appropriate way forward for you. So thanks so much for watching, and we'll see you in the next one. Bye.